Hello everyone. Today we'll be discussing about an introduction to autonomic pharmacology. We'll be mainly studying the functional anatomy of the ANS, but before we actually talk about the ANS, let's look at the nervous system as a whole. Now, the nervous system can be classified or divided into the central nervous system, which consists of your brain and the spinal cord, and the peripheral nervous system, which is everything else. Basically, the job of the peripheral nervous system is to establish a connection between the central nervous system and the peripheral organ, like the muscle, the glands, or everything else. Now, the peripheral nervous system consists of the somatic nervous system, which is also known as the voluntary nervous system. This, for example, innervates the muscles, the skeletal muscles, which are under our voluntary control. Now, other than that, there's obviously the autonomic nervous system. Now, as the name suggests, the actions of the autonomic nervous system are automatic. That is, they're not under our control. So, thus, they're also known as the involuntary nervous system, the visceral or the vegetative nervous system. What the autonomic nervous system does is it alters our bodily or visceral functions like the cardiac output, blood flow distribution, digestion, glandular secretion, micturition, etc., etc. Now, if that uh, categorization wasn't enough, the autonomic nervous system can be further classified into the sympathetic nervous system and the parasympathetic nervous system. Now, before we discuss about the anatomy of both these systems, I think it would benefit us if we understand the basics of autonomic nerve transmission first. As we have established, autonomic nervous system is a part of the peripheral nervous system whose job is to establish a connection between the central nervous system and the peripheral organ or the effector organ. So the autonomic transmission actually begins from the central nervous system, that is the brain or the spinal cord. Now, there is a nerve which relays in something called the ganglion. Ganglion is nothing but a collection of cell bodies outside the CNS or in the PNS, the peripheral nervous system. Now, since this nerve is relaying into the ganglion or it's coming before the ganglion, it's called the preganglionic neuron. Now, this preganglionic neuron releases a neurotransmitter which stimulates the receptors present on another nerve which exits the ganglion or comes after the ganglion. And this neuron is known as the postganglionic neuron. This postganglionic neuron is the one which actually releases the neuroeffector transmitter, which acts on the effector organ and brings about desired action. So now that we know about the basics of autonomic transmission, let's discuss about the anatomy of the sympathetic and the parasympathetic nervous system. Now let's start with the brain and the spinal cord, the central nervous system. On the left side of the screen, I'll be illustrating the sympathetic nervous system. So the sympathetic nerves have something called thoracolumbar origin. Basically, what it means is the preganglionic neurons originate from the thoracic and the lumbar segments of the spinal cord. So, as we can see here, this preganglionic neuron in this case is originating roughly in the thoracic segment of the spinal cord. This relays, sorry, this relays in a ganglion where it releases acetylcholine, which stimulates the postganglionic neuron through something called the NN receptors. We'll discuss about the NN receptor in the future, so it's fine if you don't know what the NN receptor actually is. So uh, now we have the postganglionic neuron. Now, an important distinction that we need to make is the ganglion, in case of the sympathetic nervous system, is actually located close to the spinal cord. What it means is that the preganglionic neurons don't have to travel a long distance before they actually relay. So, in the sympathetic nervous system, the preganglionic neurons are actually short, but this would mean the postganglionic neurons would have to be quite long because they have to travel a long distance before they can relay in the effector organ. Now, another
important fact is that the preganglionic neurons don't necessarily have to relay, in an actual ganglion. Uh, these can relay in the adrenal medulla through the NN receptor. So these are the possibilities. Now we'll discuss about the main neuroeffector transmitter. So it can be dopamine, norepinephrine, or epinephrine through the adrenal medulla, which is released directly into the blood because it's a hormone. Now, dopamine mainly acts on the CNS, the GI tract, and the kidneys. Norepinephrine and epinephrine acts on the effector organ through something called the alpha and the beta receptors, which we'll discuss in detail in the future. Now, this was the anatomy of the sympathetic nervous system. Now, let's discuss the parasympathetic nervous system on the right hand side of the screen. Now, the parasympathetic nerves are said to have a craniosacral outflow or craniosacral origin. So, the preganglionic nerves originate directly from the brain or from the sacral segments of the spinal cord. So, in this case, I'm illustrating the preganglionic neuron originating directly from the brain. Now, since this nerve is originating directly from the brain, that means this is nothing but a cranial nerve. To be specific, these are cranial nerve 3, 7, 9, and 10. The oculomotor nerve, the facial nerve, the glossopharyngeal nerve, and the vagus nerve. These relay in the ganglion where they release acetylcholine, and the transmission is continued along the postganglionic neuron. Now, important thing to note is in case of parasympathetic nervous system, the ganglion is actually located close to the effector organ instead. So that means the parasympathetic nerves have a long preganglionic neuron but a short postganglionic neuron. This is exactly the opposite as seen in the case of sympathetic nervous system. Now, I just illustrated cranial outflow. Let me also illustrate sacral outflow, where you have basically the same thing, a long preganglionic neuron and a short postganglionic neuron. The effector neurotransmitter is acetylcholine in this case, which acts on the effector organ through the muscarinic receptor. Now, since the neuroeffector transmitter is acetylcholine, the parasympathetic nervous system is also known as the cholinergic nervous system, and the sympathetic nervous system is also known as adrenergic nervous system. We will be using these terms interchangeably in the future. Now, by the end of this slide, the major things that we need to know is the sympathetic nervous system has thoracolumbar origin, short preganglionic neurons, long postganglionic neurons, and the main neurotransmitters are dopamine, norepinephrine, epinephrine, which acts through the alpha and the beta receptors. And in case of parasympathetic nervous system or the cholinergic nervous system, the origin is craniosacral with the long preganglionic neurons, short postganglionic neurons, and these act through acetylcholine on the effector organs through the muscarinic receptor. Now, I want you guys to know that irrespective of the system, in both the cases, the preganglionic neurotransmitter is actually acetylcholine, even in the case of sympathetic nervous system. So now that we have discussed or illustrated this whole anatomy, let's put this in a tabular column where, as I've said, the origin of the sympathetic nervous system is thoracolumbar, parasympathetic is craniosacral, the preganglionic and the postganglionic fibers are short and long, long and short, as we have already discussed. The reason for this short and long fibers is the ganglia is located close to the spinal cord in case of sympathetic nerves, but they are located close to the effector organ in case of the parasympathetic nerves. Now, the main neurotransmitters in sympathetic neurons are epinephrine, norepinephrine, dopamine, and it's just acetylcholine in parasympathetic nerves. Now, there's an exception to this rule of sympathetic neurotransmitters. There's something called sympathetic cholinergic nerves, which sounds contradictory. Basically, this thing is seen in the case of sweat glands. The innervation to the sweat glands is considered sympathetic, but the action is actually brought by the action of acetylcholine and the muscarinic receptor, which is a cholinergic receptor. So let's illustrate this. Here we have the central nervous system. There is these are the spinal sympathetic nerves. I say these are sympathetic nerves because the origin is thoracolumbar. But the thing is, the neuroaffective transmitter in this case is actually acetylcholine, which acts on the sweat glands to increase sweating, and the action is actually through the muscarinic receptor. So even though the action is brought upon by acetylcholine and muscarinic receptors, this whole thing is still considered to be sympathetic. The innervation to the sweat glands is still considered to be sympathetic. Now, to end off, finally, let's discuss a few important sympathetic and parasympathetic actions. I personally believe these would make more sense after we have discussed the receptors, but I'll still be discussing the major differences or actions. Now, people generally remember the sympathetic actions by imagining themselves in a state of emergency or by imagining a lion in front of them. So, if a lion comes in front of you, your heart rate would increase, your bronchus would dilate because you need to breathe more, your pupils would dilate so that you can see more and you can plan your escape, your GI and your urinary activity would decrease because when you're in a state of emergency, when you're running from a lion, you don't want to waste time defecating or peeing. So these are the major actions or differences, whatever. Now, this was it with the lecture. Now, next we'll be discussing about an introduction to cholinergic pharmacology. Thank you.